I'm going to repeat that. Good morning, and good morning.
Yes. Yeah. Now we are all.
Ladies and gentlemen, good morning from India. It's really midday over here, but that good morning goes to all our listeners in the UAE. Children are the future of the world. They are the future of the world. And yet, for the first time, perhaps for the first time in millennia, we have discovered that children are less healthy than adults. And in fact, it is perfectly possible that they may live a poorer quality of life, even while the length of life may be long, their health towards the end would perhaps be much worse as it is at present. Now, according to the WHO, if we were to talk specifically about obesity, according to the WHO, more than 400 million children, that would be about 30% of the world's population, is overweight or obese. Another statistic tells us that there are more obese children in the world than there are thin children or malnourished children. And if we come closer to home, the UAE, we have a ratio of about 30 to 40% of our children who are overweight. And if we look at parents, our own research in the RAK Hospital, over several thousand clients every year, gives us a figure of above 60% adults being overweight. And that, unfortunately, is an example that children are following. If you were to go into the RAK Hospital research on children in terms of school health, we find that 47% eat fast food items every day. 45% of children watch TV for more than 2 to 3 hours every day. 20% of children have no physical activity whatsoever. And if I were to hazard, I am not an expert like Dr. Vishal is, who incidentally is also the most popular pediatrician in RAK Hospital, voted in by our children. However, if I were to hazard a general opinion about obesity, and I am sure Dr. Vishal will give us better information on this. My own concern is in 3 areas. One, I've mentioned low levels of activity. When we were young, our activity was to go out and play. Today, computer games have taken over. Advertising, the advertising of fast food is driving our children to those fast food and commercial food situations. As a consequence, we have the problem we have today. And ladies and gentlemen, without much ado, I will introduce our eminent speaker. I've already mentioned in advance that Dr. Vishal is the most popular children's doctor or pediatrician in RAK Hospital. Now, I must tell you that I'm far from a child, but I find that Dr. Vishal is a very likable individual. He completed his MBBS way back in 2002 from the Jawaharlal Nehru College in Belgaum, and he went on to do his MD in pediatrics from the prestigious PIGMR in Chandigarh, where he also worked. And talking about work, he has more than 19 to 20 years of experience in PIGMR, of course, and other prestigious institutions. The list of prestigious institutions in which Dr. Vishal has worked is in fact the list of prestigious institutions in India. He has worked in the Tata Memorial Hospital with pediatric oncology. He has worked with Lilavati Hospital, Fortis Hospital, several others, and we are honored to have him with us in RAK Hospital. Ladies and gentlemen, children, remember, children are the future of the world. And if you want to see solutions, I am sure you will find them in Dr. Vishal's presentation. Dr. Vishal.
Good morning to all of you. Yeah, let's proceed with the presentation. Yeah, can you see my presentation slides? Is it visible to all of you?
Very clearly.
Yes. So today we are going to talk about a very common childhood problem, that is obesity. Obesity. Childhood obesity is one of the very major concerns in today's world. And we can see that the babies, the toddlers, and the teenagers are facing serious medical conditions due to the excessive weight. Now, before we talk about it, let me just take you through the statistics. We have seen that the amount of obesity has almost tripled in last 25 years, and more so in children above 5 years. So we can see that in the children between the age of 5 to 15 years, the obesity has increased drastically. Now we see that almost 1 in 3 child today is either overweight or obese. And if the same trend continues, then probably next decade, we would see that this number would be 1 in 2. Even with the age, the number of kids getting obese is increasing. And if you look at the worldwide statistics, Middle Eastern countries have one of the highest incidence of obesity. Almost 30 to 40% of children are obese or overweight in the Middle Eastern countries. One of the study which was presented by in Abu Dhabi, we found that almost more than 30% of kids were either obese or overweight. Now, before we go into the details of obesity, first let's understand what is obesity. Now, there are 2 parameters which we can use to define obesities. The most important one is the weight of the child. And the second one which we use is BMI, that is the body mass index, which is calculated depending on the height and the weight of the child. If the child is more than 85th centile in the charts, then the child is considered to be overweight. And if he is more than 95th percentile, then he is obese. BMI charts are available for different age groups more than 2 years age, or simple weight charts can be used to determine whether the child is in overweight or an obesity or morbid obesity levels. Now, if you look into the cause of the obesity, there are multiple causes for the childhood obesity. We can say that now we are currently in the epidemic of childhood obesity. The many hypotheses which explain, one of the hypotheses which is also talked a lot about is genetic causes. But if we look at the sudden increase in the number of kids becoming more obese, it's unlikely that genetic would be the only cause for the obesity. So it is definitely, we are looking in a lot of studies that there is a marked change in the lifestyle, the food habits, And that has changed a lot in last 2 to 3 decades, which corroborates with the increased incidence of obesity. So if I have to classify the causes, let me broadly classify into two groups. That is a modifiable and an unmodifiable factors. Now, unmodifiable factors are those which are genetic or ethnic, or we would say you have been during the time of birth, what happened. So those factors are usually non-modifiable factor. But vast majority of the causes comes under the modifiable factor. And we can see that in them, mainly what it is related is to the lifestyle as well as the food intake. So the lifestyle, physical activity and diet plays the major role as a cause of obesity. So when we talk of obesity, let's first try to differentiate the primary obesity from a secondary obesity. Now, secondary obesity amounts to a very small percentage of children, which is wherein, children develop overweight secondary to certain underlying diseases. For example, an endocrine disease or a kind of iatrogenic, wherein medications can cause or certain genetic conditions can cause. But far more common is an idiopathic obesity, which is related to the lifestyle. Now, I will quickly go through some medical causes for the obesity in the children. So let's classify into three major groups. First are the endocrine causes for the pediatric obesity. Now, common cause endocrine problems like growth hormone, thyroid, cortisol, or parathyroidism can be associated with the obesity in the children, but they are also associated with the short stature or the decrease in the height. Now, certain causes like, you had a head injury and where you had a hypothalamic injury, that can also lead to obesity. And such kind of obesities will not be modified just by lifestyle modification and will need kind of, depending on the kind of disease, will need the medical treatment. So this is just a slide to show you how the different hormones would affect the growth rate, but also to mention that, that it is always affecting the height. So for an example, like obesity can also be a part of genetic syndromes, children like Prader-Willi syndrome, wherein there is deletion of a paternal expression of chromosome 15. And here we see that in Prader-Willi syndrome, almost 50% of kids are obese. And by the time they get adult, 90% of children would be obese. But it's a very rare condition. It happens 1 in 30,000 live birth. So similarly, like Prader-Willi, there are other genetic conditions as well as certain monogenic gene mutations which can also lead to obesity, but this amount to a very, very small percentage of children. So if we have to broadly look into these kids, see, if we have a child who has an early onset of obesity with mental developmental delay and a short stature, then you would think of certain kind of genetic problem with the child. Whereas you have a child who is normal or has an increased linear growth, his height is good and has a normal mental development, then usually this is idiopathic obesity or more of lifestyle related. Whereas if we have a child who is normal, mental development is normal, but we see that his height is less or his bone age is delayed, then we suspect for the endocrine cause and we evaluate accordingly. Now, obesity has become a vicious cycle. The child, at a very young age nowadays, they get used to the video games or high-fat foods, or sometimes only studies, no physical activity that leads to mild obesity in the child. And once the child is mildly obese, then it decreases their physical activities, and that leads to moderate obesity. And once there is moderate obesity, child finds it painful and uncomfortable to do exercise, and that leads to more severe obesity. And severe obesity will lead to secondary comorbid problems like musculoskeletal problems, asthma, and many other symptoms. And when these children grow up as an adult, then they have secondary diseases like coronary heart disease, diabetes, and it also leads one of the major cause for premature death in people. So what has changed in past decade? If you look at, I would just give you one example. Like now, most of the children before used to walk to the school, or they used to use bicycle while going to the school. But now we see in the today's era that most of the children are either taken to school by bus or their parents would drive and drop them. So that has decreased the physical activity. They use more escalators or elevators than walking up the stair. Again, decrease in the physical activity. Children stay indoors more after school, and especially when parents are working or other reasons, they don't have that much of outdoor activities. Television viewing has increased significantly. So again, this decreases outdoor activities. And then at home, they have video games, mobile, computers to play with. So they are not playing sports with other children. And even there's less stress of physical education in the schools now. So all these things, has changed in past decade, and that has led to a decreased physical activity, in turn increasing the number of children being obese or overweight. Now, if you look at the food changes that has taken place in last few decades, even there is aggressive marketing of the fast food. Junk foods are available everywhere. Children with video games are great toward more of food preference, which are commercially advertised. So when they are watching TV and they see those advertisements, they would like to have same kind of food. Even in the fast food centers now, the portion of the food has increased. This is many outlets offer large portion of the meals with a lesser cost. So we end up buying a bigger meal because it would save money. And then we end up eating more fast food than it is required. We can see today, as Professor Kennedy mentioned, in our local study as well as the worldwide, we see that more than 1/3 of the children nowadays eat fast food on almost everyday basis. So 1 out of 3 child is eating fast food each day. And also even in the school nowadays with vending machine, they contain a lot of snacks with empty calories, and that also leads to excessive calories in the children. So what are the risks of obesity? What are we concerned about in obesity? There are several risks. The research studies have been reporting that obese children are more frequently diagnosed with type 2 diabetes and are also showing early signs of insulin resistance. And they end up having more cardiovascular disease than the children who are not obese. We have also observed that more than 50% of the kids who are obese at young age will end up being an obese or an overweight adult. And that would further increase their health risk with the multiple health problems, including the risk of premature death in them at a later age. So if we have to summarize the different problems which can happen because of obesity, let me take you through the certain systems. Like for example, in cardiovascular system, it leads to hypertension, cardiovascular diseases, dyslipidemia, and chronic inflammation. In endocrine, it leads to insulin resistance and type 2 diabetes. In girls, it can lead to polycystic ovarian disease, or it is also resulting nowadays in precocious puberty. Musculoskeletal problems like slip capital femoral epiphysis, Blount's disease, fractures, flat foot, gastrointestinal like fatty liver with gallstones. It also leads to psychological problem like depression, eating disorders, poor self-esteem, and all multiple problems can happen because of this. So do we need to investigate the children with the obesity? Now, routine labs are not investigated. There is routinely no investigation required for the child with obesity. But the children who are more than 6 years old and have a BMI more than 85%, they should be screened for the complication and the comorbid condition of the obesity, especially for the diabetes as well as the cardiovascular complication. So what we do is for children who are more than 85% of BMI, we are getting regularly baseline lipid profile, fasting glucose, liver function test, and we monitor regularly their weight as well as the waist circumferences and height. So we can do. In addition to that, if child has other symptoms, like for example, child has hyperpigmented skin on the neck, what we call as acanthosis, then or there is a family history of diabetes, then they may need also to be evaluated for insulin resistance by getting insulin level, HbA1c or 2-hour glucose tolerance test. So this is just a slide to see how we screen for the comorbidities. And in just a special mention regarding the females, if we have a girl who has acanthosis plus BMI which is very high, has menstrual disturbances, develops acne or hirsutism, excessive growth of hair, might have to be screened for polycystic ovarian disease. And young children, if they are severely obese, then they should also be screened for sleep obstruction. They may have obstructive sleep apnea, and they should be screened for hypertension. If the child has hypertension, then they will need evaluation for ventricular hypertrophy, wherein heart muscle hypertrophy or other cardiovascular diseases. This is just a slide to show that girls who are obese and have hirsutism can have polycystic ovarian disease. This is because of excessive androgenic hormone, which is produced by the ovaries. And these children may have hyperinsulinemia, and that can cause overweight in them and associated menstrual disturbances. So if I have to look at the approach now, let me classify the kids into 3 age groups or 4 age groups. So children who are less than 5 years, the most important, they are in a fast growing age group. So here the focus should be is to identify the patients who are at a future risk of developing obesity, and we should be preventing it, screening and counseling. Whereas the children between 6 to 10 years age, wherein you look for secondary factors, you identify the obesity early. So of course we need early screening, counseling, diagnosis and treatment of, like, for example, early puberty, or there are hyperlipidemia or diabetes or other thing has to be done. In adolescent children, it becomes very important that we screen for the obesity and look for the comorbid conditions like polycystic ovarian disease, type 2 diabetes mellitus, and metabolic disease. And in older kids, if they still are obese, then of course, other than the prevention, we have to make early diagnosis of secondary complications and refer them for the treatment of the comorbid conditions. Now, when we come to the treatment of obesity, the best treatment of obesity is prevention. There have been several studies which are focusing now on the impact of nutrition and insulin sensitivity in the children. So healthy nutrition has to start right from the infancy. So it is not just that we started later, it has to be right from infancy or even before that during the pregnancy. So the main treatment of the obesity even today is diet and exercise. So what are the goals when we are treating the obesity? See, the simple treatment here is that we increase the expenditure of the energy and decrease the calorie intake while you are spending more energy by physical activity. So here the long-term objective of when you are treating obesity is that we have to reduce the BMI and also reverse or prevent short-term and long-term complications happening because of obesity. So what can we do for our children? It's very important that we need to make a planned strategy when we have a child with obesity. Now, it's important that we understand what is healthy weight and dieting. Dieting is not something we advise for the kids. Nowadays, because of the kind of stigma attached to obesities, there have been high number of children having eating disorders, especially anorexia or bulimia in the past decade. So children, even as young as 5 years now, have shown that they have like purposeful avoidance of the food or weight loss behavior due to their body dissatisfaction. So important emphasis we have to put is on physical activity and eating right type of food rather than dieting or restricting any kind of food. So there should never be stigma which has been attached to the overweight, and child should maintain his self-esteem. It is very integral part of planning when you're managing the obesity. What we do is usually we ask the children, to make healthy choices. And it should start from a very early age. What we learn at a very young age, we continue to be same at the adulthood. So parents can be a good role model. If we do something, kids will copy us. So they imitate us. So if we have an healthy food at home, the kids look at us and they do make a healthy choices of the food. Food should never be used as a reward or restricted as a punishment. Children should never be force fed. Force feeding again, leads to obesity in children. So if I look at how to end the obesity, these are one, right kind of diet, promoting the more physical activities in the children, good health and nutrition, physical activities in the school, weight management programs can help us to, reduce the obesity in the children. So what is the role of lifestyle and diet? Studies, we had studies which used those motion sensors, and they have shown that the children who spend less time in moderately vigorous activity, so if they're not playing sports and they're not active, then they have a very higher risk of becoming obese during childhood and adolescence. There is also positive correlation between the hours of television viewing and overweight. This is more so in little bit older kids, but now even in toddlers, we see that they spend more time on television watching. Eating pattern in children and adolescents have also changed. Skipping meals, having no breakfast, but then having a very heavy dinner. All this kind of pattern changing in eating has also increases the obesity. So the dietary factor that places child at risk of obesity includes high fat and excessive calorie intake. So we have to advise these children, right, make a healthy, not dieting, but make a healthy food choice, never skip their meals. So mild calorie restriction may be safe, but and their families are motivated and encouraged to have long-standing behavioral changes. For example, we can eliminate and decrease unhealthy food. For example, juices, excessive snacking, junk food can be reduced. There is also important that we understand the specific micronutrients pathogenesis while managing. So low fat versus low carb, extreme diet don't seem to be acting. It doesn't help the child. So we need all kind of food, but in a right proportion. So reduction in specific nutrient, like you stop only carbs, sugar, fat, calorie, works well when provided you have a specific goal while treating this. Now, we also have to encourage the physical activities. Children should be encouraged from a very young age to participate in the physical activities. It can also be done as a family activities, wherein they get an opportunity to not only be active, but also bond with the family. And this improves the health of the family overall. There are many examples where you can have different kind of family activities. Like, for example, you can go for a bike riding together, or you go for a picnic to a local park and there you take some play equipments, or you go for a kind of swimming or skating with the family. So there are many family activities can be done, and this helps both for bonding in the family as well as it increases physical activities by involving adults also, and that sets a good example for young kids to do the same thing. Now, how to limit the television viewing? We need to find an alternative ways to keep children engaged, especially when it comes to toddlers. So encouraging children to read books at a very young age can help us to avoid too much of affection toward the television or the mobiles. So just to mention about the eating disorders, nowadays it is shown that the overweight teens nowadays are more likely to engage in disorganized eating, meal skipping, food avoidance, starvation, binge eating, as well as self-induced vomiting, and use a lot of laxative and diet pill. Now, one of the studies showed that almost 36% of teenage who were seeking the treatment for ED were previously overweight, in whom the BMI was more than 85%. So there is a direct correlation between the eating disorder and the obesity. It is both as a cause and also a result of it. So what are the preventive things we can do for preventing this? One is we have to discourage dieting, skipping of meal, or use of diet pill. And instead, we should encourage and support the implementation of the healthy eating and physical activity behavior that can be maintained on an ongoing basis. The focus should be on healthy living and healthy habit rather than on the weight. We have to promote positive body imaging among the adolescent and do not encourage or point toward the body's dissatisfaction in the children. Um, we also encourage to have more frequent family meals so that when they sit together, they have a kind of healthy meal, they watch and they learn. Studies have shown that children who participate in regular family meals are less likely to develop eating disorders also. Encourage family not to talk much about the weight, rather than talk more about the healthy eating, being active to stay healthy. Inquiry about a history or mistreatment or bullying in the school because of the overweight or obese teenager has to be done. So when you're sitting for a family meal, it gives an opportunity to discuss with the child. And it is very we have to do a careful monitoring of the weight loss in adolescent who needs weight loss. And also we have to make sure that they don't develop any kind of medical complication because of semi-starvation. So yeah, we need to continue with the healthy diet for them. Now, just a quick mention about the depression and the mental health problems in the obese children. It is in a prospective study of over 9,000 youth, depression mood significantly is predicted in obesity. So, we did a study of 9,000 youth, and we found that, depression was very common in obese, even when we followed up them for 1 year. And even it's vice versa, the children who had more of depression and anxiety, they ended up being more obese later on. So there is a definitely direct correlation between the pediatric obesity and the mental health problems such as depression. Now, coming to the pharmacotherapy, a lot of people would ask, give me a medicine. Why do I need to exercise? Why I need to do diet? But to mention here, the pharmacotherapies in obesities, a lot of studies have been done, and they all lack the safety options. So there is no magic weight loss pill exist at this time. And even if you look at the FDA approved medications, till now, there is only one medicine which is approved by FDA, and that too in children more than 12 years age. Nowadays, a lot talked about the bariatric surgery. The long-term success of lifestyle intervention and pharmacotherapy is subject to with severe obesity in general has been disappointing. So the more aggressive approaches such as bariatric surgeries are generally limited or done only for the children who have extreme obesity with other serious comorbid conditions. Then it has been offered for in some centers, well-organized centers where they have a well-written protocol. Just to mention that, post-surgical care in such children, with electrolyte imbalance and other thing is challenging. So it is restricted only for extremely obese case with other medical problems because of the obesity. So to conclude, pediatric obesity is a very real and rapidly emerging problem and a risk to the general population, and affects the health and well-being of the future generation of the children. We know that obesity is multifactorial. Much not to know about the origin about the obesity as well as the treatment. But the best treatment as of now is prevention, and our focus on the treatment is in the direction of healthy diet and increased physical activity. Thank you so much.
And thank you, Dr. Vishal. Thank you so much. Thank you so much. The information you provided was extensive. It was truly extensive. And if I may pick up just one or two points, I recall you mentioning that obesity was an epidemic which has infested countries around the world and the majority of children. Two interesting factors that you mentioned was the family activity aspect. And you mentioned that family activity can encourage children to modify their lifestyles. And you spoke about swimming with children. You spoke about cycling. You spoke about playing soccer within the family. You spoke about gym sessions. And I point this out, Dr. Vishal, only to mention to you that I have, what shall I say? I score 100 marks on 100 for this activity because I take my grandchildren out every day and make them do these. Don't make them, they make me do these activities. You also spoke about a more serious angle from a social perspective, and that was you touched upon advertising. You touched upon junk food. You touched upon uh, large portions that are being served. And you defined that all this led to several risks, hypertension, diabetes, even in children, which was unheard of in my time. The main message that you emphasized, and because of this main message that you have emphasized, which is diet and exercise, I hereby make you an honorary member of the Lifestyle Association of the Globe. Thank you so much, Dr. Vishal. Thank you so much. Dr. Wilku, sir, you have questions.
Yes, sir. First of all, thank you, Dr. Vishal, for a wonderful presentation. I think you have covered every aspect and whatever questions generally we come across. And I have received many questions. First, I will take, there is one question, interesting question. Before that, I would like to ask, generally it's seen, children tend to be obese if the parents are obese. How much hereditary impact on obesity in the children?
Thank you, Dr. Vilku. Thank you, Dr. Professor Kennedy. Yes, as I had mentioned in my presentation, that there are modifiable and non-modifiable factors. So genetic or the certain kind of mutation in certain kind of gene can also lead to obesity, and especially it can run in families sometimes. But there is always an interaction of genetic and the environmental factor that leads to obesity. So genetic factor is very, very less, and I would say it is in a smaller proportion affecting than your environmental factor that is causing obesity in the children. So modifiable factors are those which we can modify by our better lifestyle and making healthy food choices. So if I would put in percentage that, if I have 100 kids with the obesity, then probably genetic cause would be in less than 5, and 95 of them, it is because of the lifestyle related or activity related obesity.
That was a very wonderful answer. Now, connected question is, Simi has asked, because we come across this very often. She is mentioning our 14 years old daughter is obese. Her BMI is 26.5, quite high. She is active, plays outdoor games, not a foodie type of person, no family history of obesity. What would be the reason of her obesity? You have mentioned, but this question is interesting.
Yeah. See, there is no family history. Yes. Yeah. Now we have to look into the physical activities in a more structured manner. When we talk about physical activities, what kids are doing, it has to be a little moderately vigorous. It should not be that just I went for a walk for a child at this age. So I would stress on that, definitely we need to increase the moderate physical activity. And it is not important that she has to be, eating a lot of junk food only. But is she eating regular? Is she not skipping her meals? Is she eating right kind of food? That would help. So in such cases, I always recommend parents that, take a help of an trained dietitian who can sit and, with you and make a diet plan. I won't call it as a dieting, but it is a food plan which can help us to regulate the kind of food intake. So it has to be balanced. It should not be that you eat less. You have to eat good, but you have to eat right, healthy food. So involvement in physical activities like sports activities, just going out and playing sometimes is not giving them vigorous activities. So these two factors will definitely help in better BMI and thereby prevent any secondary medical complication. Now, also to mention is look at the height of the child. If you have a child who is very short in height, or with the obesity, or you have other medical issues like child has excessive acne or other thing at this adolescent age, then we might have to look into certain secondary causes of obesity. So you may look for medical condition. For example, in girls we look for polycystic ovarian disease. I'm not talking about the specific this child because we don't know the medical part of it, but in general, if you have an adolescent and a high BMI, yes, we need to do lifestyle modification, healthy diet, but also look for comorbid conditions or any medical causes of the obesity. So we should get a proper health checkup for this child.
Yeah, that was a good answer. It's interesting, people, because we have the challenge for only adults, people over 18 years of age. But it's very good to see that parents are also concerned about their kids. Osman has asked, I am insulin dependent diabetic. He is a diabetic person dependent on insulin. My 15-year son is flabby. He feels lethargic most of the time. Is he developing diabetes, or it is due to because of the obesity?
Yeah, no, the diabetes, definitely you have a family history and child if is in adolescent age and obesity. So you have to definitely get a screen or annual checkups to look for the diabetes. Lethargy in general cannot be the only symptom of diabetes. Lethargy can be because of the poor lifestyle. If child is physically not active, that can also lead to lethargy. So, encouraging to be more physically active, involving him in certain kind of sports activities would decrease his lethargy. Spending less time on gadgets and also encouraging to take healthy vitamin supplements, because certain kind of other vitamin deficiency, for example, if child is anemic or has vitamin D deficiency, these kids also tend to be a little more lethargic than normal. Now, a lot of these things, when we talk about, they are subjective. I say my child is overweight or underweight, you have to look at it in an objective manner. So there are growth charts available. Even WHO as well as NHS growth charts are available online. So we can easily plot it today on those charts and then look whether your child is there on that range or not. And please don't forget to, compare it with the height. So if you calculate BMI, we have those BMI charts which can be followed. So just subjectively feeling is not enough. But yes, vitamin supplements, good physical activity and healthy diet would help the child to be less lethargic. And not to forget, if family history, we should get a annual checkup for the diabetes for the child.
Yeah, I think that's a good thing. Now, this is a concern most of the parents are having. Even I have the same concern. Rajneesh is asking, my son loves to eat fast food, especially pizza and burgers, nowadays popular for the kids. How to prevent obesity? You have already mentioned, but as an interesting question because every parent has a concern of this.
Yeah. This is what we were discussing, that, why does he like junk food? That is the root cause we have to get into, that why does he love junk food over the other food? See, I would put it in three important things. One is, because of nowadays too much of marketing, what you watch on TV, they show that it is very cool to have this food. So children at a very young age, they find it, more interesting and exciting to try this kind of food. So second important thing is what parents, we have it, we have nowadays, you might have seen in last couple of decades, parents also every weekend or at least twice in a week, we have to go out to eat the food. And when we go out for the food, what we do end up is having a junk food sometime. So as a role model, we have to also set a good example. That is how, children interest will change. Children learn what they see. Children learn what they watch others doing it. So when they are not seeing something or not seeing others doing the same for a very long time, then definitely their behavior can be modified at a very young age. We need to, keep them away from the fast food as much as possible. I'm not going to say the child should never try any food, but it has to be a kind of balance between a healthy diet and try to keep minimum or, if possible, away from the junk food.
I think this will help all the
There has
parents
been,
to.
we know that it's very hard when you talk about the parents,
Very,
but if they make up their mind, it is not difficult. I have seen parents where they don't have junk at their home at all, and the kids don't know. You won't believe, I had a child who was 3 years old who came to me, and my nurse offered a lollipop to him, and he refused to take the lollipop because he don't know. He has never tasted lollipop. What it is, he don't know. So no, it's not in today's era, because it's there everywhere. It is little difficult, but if we kind of practice it in our home on a regular basis, children interests can be changed. This is good about kids, is you can change or modify their behavior when they are young.
yeah, when they are young. That's the tagline. Okay. Now, most of the questions what I have received is a similar type, but I will take this question. It's not related to obesity, but being a specialist in pediatric, I will take this question. Saida is asking, my 2 years daughter doesn't like to take vitamin syrup for the past 8 months. What should I give her? You are
No,
an expert in this, so you should be.
yes, yes, yes. All children don't need vitamin supplements, There are various forms of vitamin supplements, different flavors are available, different forms, including, nowadays with gummies and so many things are there. But the emphasis should not be only on vitamin supplements, but it should be on the healthy diet. After all, vitamin are present in our diet. So if we have a right kind of balanced diet, right kind of food intake, then probably we don't need any kind of supplements, So good eating habits, healthy food eating can prevent her from having vitamins. If the child has any other medical condition and it requires iron or a vitamin D or other kind of vitamin supplementation, then there are various choices nowadays, depending on the child choice. There are different flavors, different forms available, and we can, according to the child's preference and the family's convenience, such kind of choices can be made. Nowadays, there are plenty in the market. Even we have mango flavors and orange flavors and all those things.
No, if you look at the current scenario, kids are having a lot of choices. We didn't have. Okay, so I think most of the questions are repeated, but I will just request you to give a takeaway message in three important lines, sir.
Yes. See, three important points is, first thing is, we have to accept that obesity is an current epidemic. It is increasing in a very fast number. But we should not attach so much of importance only to the weight, and rather than talk about eating healthy food, getting more physical active. Second, genetic, yes, it does play a role. Familial does play a role. Certain medical conditions can also be a cause of obesity, but they are very small in number. Still, vast majority of the children, it is idiopathic obesity. And the last take-home message is, prevention is better than treatment. There is no magic pill which will treat obesity. So it's better you start at a very early age, develop good eating habits and physical activity at an early age. So kids, when they start it at a very early age, they continue the same thing even by their adulthood. So by healthy diet, healthy food, and exercise or increasing physical activities, it is obesity. We are going to win the obesity.
Yeah, that was a perfect suggestion and takeaway message for all the parents, and we should be following your instructions also. So I think from my side, we are over. Professor, over to you.
Thank you. Thank you, Dr. Vishal. Thank you so much. And Dr. Wilku, thank you once again for streamlining the questions. You always ask such interesting questions. Thank you so much for that. I would like to thank Dr. Vishal once more on behalf of the children of the world, in a manner of speaking. If we could all, we parents and grandparents could follow Dr. Vishal's advice, the future would be bright. Thank you so much, Dr. Vishal. I'd like to thank Dr. Wilku and the support team for all the work that they put on throughout the week, selecting a topic, selecting a speaker, connecting with the speaker, putting all the systems in place, talking to people from different parts of the world to connect a single webinar. And Dr. Wilku does this every week without fail. I don't know whether it's good news. Well, I'm sure it's good news for Dr. Wilku, but not so good news for us that this, unfortunately, is the last webinar in this particular series. But I'm sure Dr. Wilku will think up another series. He has already thought up the diabetes series. He's thought up a COVID series prior to this. There's this weight loss series. I'm sure he'll think up something more in due course of time. I thank you to our audience. Thank you so much for coming in for these programs. You are the life of the program. We do it for you. Thank you so much for coming in. Ladies and gentlemen, I did mention that this was our last webinar. And I would like to draw to your attention that, can we have that slide, please? The slide that, yes, this is it. Members of our audience, thank you so much. It is the 10th, but on the 18th and 19th of this month, we will have the final weighing in. We've had about 10,000 participants who have managed their diet and done their exercise and met their physicians and lost weight. In the previous session, I recall that we had an average weight loss of about 10 kgs for those who completed the program. I'm hoping for similar results over here. So I would like to congratulate everyone for participating and to tell them that on the 18th and 19th, we have the final weight, the final weighing in, the physical category. We'll have it at the RAK hospitals. The virtual category can check their weight at any clinic and upload those details. And the winners and the fabulous prizes, including the cash awards, will be made available on the 22nd of March in RAK Hospital at 11 a.m. With that, thank you, ladies and gentlemen, and we will see you at the final weighing in. Thank you so much and have a great day.